Hey everybody, it's Dr. Wellwood and welcome to the clinic. Today I've got a rather long video for you guys. I had some parents bring their 19-year-old beginning weightlifter in, complaining of some right wrist pain and some lower back pain. So the video you're actually going to be seeing from them is actually the one that they taped. I had lost my video, so unfortunately we're not going to see that, which also means the audio is not the best on this. So I've tried to do my best to kind of ramp it up for you guys, but we'll see how it goes. Either way, it's a pretty long one because you're going to see me talking about the condition as well as what it is that I'm thinking at the time. And so kind of what my thought process is from start to end. So hopefully you guys enjoy that. I show you kind of some new techniques as far as balance and sway and what we're looking at. So hopefully it kind of opens up some ideas for you. And if you have some questions, don't forget to comment down below. You guys know that I like to look at those and I do respond when I can. And if you haven't subscribed to the channel yet, don't forget to subscribe, but also like and share the video.
Sometimes when it don't really matter how I pick something up, if I move a certain way, I'll get like a pinch in my lower back, and I won't be able to basically move for the rest of that day, sometimes the day after. Okay. And then this wrist, I don't know if you can
pops
see
out
that.
There.
Yes, and it doesn't bend all the way back.
Okay. Hey everybody, it's Dr. Wellwood here at the Natural Health Center Regenerative Medicine Institute. Today we've got a young man and he's complaining some lower back and some right wrist issues. So we're going to go ahead and do a focused examination on those areas so you can kind of see how it is that the flow goes. So can you tell me about what happens about your lower back and your right wrist again?
So there'll be times when I'm picking up a object. It doesn't really matter how heavy it is or anything. It just depends on how I move, and it'll just tweak and I won't be able to move for the rest of the day.
Does the pain go down your leg at all?
It has before, like a shooting pain.
How far does it go down?
Probably about down to my knee.
Down the knee. Is it just on one side?
It just depends. Because I've had it happen on both sides of my back.
You have?
Yeah.
Okay. Is it going down the left side as well, you said?
Yes.
Okay. How often does that happen?
The last time it happened was like 2 weeks ago.
Okay. What were you doing at the time?
Cleaning.
Okay. So you're bending over, doing a lot of repetitive.
Yeah.
Okay. Any changes in bowel or bladder movement, anything like that?
No.
Okay, good. So what he's describing is oftentimes a mechanical lower back issue. Sometimes people call it sciatica. It could also be due to a condition called facet syndrome. And oftentimes it's due to a weak musculature in the lower back. So what we're going to do is we're going to do an examination on his lower back just to make sure it's not a disc problem, and then we'll work over from the wrist as well. Now go ahead and tell me what's going on with the wrist there.
I don't know, just over time it developed this large bump in the middle, and now it doesn't move.
Fall on it ever?
When I was young I used to fall a lot.
Did you?
Yeah.
Do you ever remember, has it ever been broken or is it sprained?
I don't think so.
Nothing like that? So it's pretty gnarly. You can look up the other side over here, so get a comparison there. You can see how much it's actually bulging out over here. So this can actually cause what's called a disc or a visci. So it's basically an instability. That bone moves back and forth. So that might be a chiropractic issue, that might be a prolotherapy issue. If we're doing injections, then we would actually stabilize the posterior ligaments here to suck it back in. But sometimes we can actually just manipulate it and it'll go away. And that's what we're kind of hoping for today. So we'll do an examination there. So since that's such an easy thing to look at, I'm going to have a seat for me. Let's go ahead and look at the wrist first. So when you're looking at wrists, you don't just want to look at the wrist itself. You also want to look at the fingers. You want to look at the elbow. And so we're going to basically go from here all the way down. He doesn't have any numbness or tingling down the arm, so we can pretty much rule out a nerve compression at that period of time or a disc issue in the neck. So when we're talking, we want to make sure that we actually have, we examine the origin and insertion of the muscles that have to do with the control. And almost all of them attach to the carpals right here. So let's go ahead and just check this out here. Do you have any pain in your wrist ever?
That hurts.
Just by pushing on it lightly right
yes.
there? Okay. Does it ever come up from here as well?
No.
Okay, this is where the those muscles actually attach to. They go from right here to here. So sometimes when you're having that, it's actually due to over tight these muscles that do this.
Okay.
So we're just going to go ahead and do this and just kind of rotate it back around. You okay? It's sore right here, huh?
Yes.
So that's something completely different than up in here, right?
Yeah, I think so.
Okay, good. So I'm just checking the muscles between those two bones there. Now I'm going to check his arteries out. To check the arteries out, you do what's called Allen's test. So we're going to compress this artery over here and this artery over here. So we're going to squeeze right here, and we're going to have him pump his hand a whole bunch of times. Go ahead and pump it. We're just checking the blood flow in the area, making sure it's actually okay and open for me. Hold it open for me. There, you can see how white it is. Now we're let that artery go, and you can see how much darker it gets. Go ahead and do it again for me. And open. And you can see how long it's actually taken for that palm to actually go back to normal color. And you can actually have to, when I lit up on the ulnar artery, it actually starts going. Have you ever had any tingling in the hands at all?
I think it's this hand.
Oh.
Not this hand.
So you do have tingling, but it's in the opposite hand.
Yes.
So one of the reasons why we're checking out the arteries here is because in order to heal correctly, you have to have blood flow and you have to have oxygen. So in order to get a complete healing, we want to make sure his blood flow is actually getting to the injured area. So we're just going to go ahead and provoke the wrist a little bit. And any pain when I do that here?
Not yet.
Okay. If you go way up in the back,
that hurts.
and I'm just very gently pushing
Yes.
here. If you do it yourself, does it actually hurt when you do
I
that?
can't do it.
Oh, okay, so it actually hurts when you're just
Yeah.
doing that as well. Does it ever click or pop?
No, I won't let it
Okay.
get that far.
So you're preventing it from doing it.
Yes.
So we're going to do a couple of other tests in here just to rule out other stuff like arthritis. And oftentimes you can find arthritis that's associated with the wrist, also in the thumb base. So we're going to push down here and kind of grind. Any pain there at all?
No.
And it feels really nice. I don't feel any grinding at all. Then we're going to use what's called snuff box test. That's right in through here. Any pain here at all?
No.
Okay. And we're going to go ahead and just check the motion out in each one of the carpal bones. And he's got really good motion everywhere. You can see I'm kind of avoiding the bad spot until we get to that. Because I don't want him to be screaming in pain. And I'm trying to avoid it right there as well. I'm right on the edge of it there, though. Anything here?
Did you feel it pop?
I did, yeah. So when you're just moving like this, you can actually feel it. There's a little piece of cartilage in there, and you can actually feel it slipping back and forth. And I think that's what's going on here. He's got a little piece of slipped cartilage. So oftentimes we would go ahead and get an x-ray from this just to make sure. But I'm going to go ahead and pull here. How's it feel when I pull?
That don't hurt.
It doesn't hurt at all?
No.
Now I'm going to pull, and I'm going to bring it up here like that. Any pain there at all?
No.
Okay. So when you're regular in its normal position and I do this,
Yes.
then it hurts. So just pulling it here and actually bringing it back
Actually,
alleviates the pain.
Touching it a certain way even hurts it.
Like right here?
Yes.
Okay, so let's not do that too much. So this is a potential good chiropractic candidate, but we would also follow up with that with Prolotherapy. So we would actually use dextrose Prolotherapy, and we would actually inject along the back side of here in order to stabilize that piece of cartilage that's moving back and forth there. So I'm just going to go ahead and give it a quick little bump here. Relax it, take a breath. Just like that. Just like that. I don't know if you guys heard that, but it went clunk. Now, you said you had pain with just doing this,
Yes.
right? Go ahead and try that for me. How's that? Is there any difference there at all? It's okay if it's the same.
It feels the same.
Okay. So because it's the same, that's a really good indication we'd be more likely to have a prolotherapy treatment in here to stabilize the joint. So we'll visit that in the future. You can see it's still bumping out a little bit here. I don't know. Does it actually look less? I don't know.
Kind of. It does.
It looks a little bit less. It doesn't look like it's protruding out as much. But let's go ahead and get this other one here. There's another one. So go ahead and move it back here again. How's that one now?
Oh, it hurts now.
Okay, so it's inflamed, right?
Yeah.
So another good indication that we actually have an issue that's associated with the cartilage rather than just a bone being out of place. If it was just the bone being out of place, that adjustment would have fixed it immediately and he wouldn't have any pain anymore. So we're definitely going to follow up with that with an injection procedure called Prolotherapy, which will stabilize those ligaments there a little bit more. Go ahead and move it around though and see if it feels okay. I hear it popping actually.
There for a second, this finger went numb.
Yeah. When you were moving it around?
Yeah.
Is it better now?
It feels better.
Okay. Now how's the motion? Does it feel a little bit same or better or worse?
It feels better.
Okay, good. So we have a little bit better motion and how's the pain doing?
Gone now.
Okay, good. So when you're just doing it by yourself, the pain's gone and the motion's a little bit better. Is that right? Okay, great.
I can bend my wrist further back.
Ah, good. So the follow-up for this would be to stabilize it with a wrist brace called a cock-up splint, and it basically takes your wrist and does this, and that will help stabilize that. So, and it will prevent it from getting worse as well. So you're going to want to ice and heat this area in here because these muscles again attached to all the way down here. Okay.
Okay.
So the adjustment actually did really well, but I don't think it's going to stabilize because it's been out for quite some time, obviously. So yeah, so it's definitely unstable, and we're going to want to get some prolotherapy on that. And we'll do that at a later date. Let's go ahead and talk about your lower back. So go ahead and stand up for me. So you said you have some lower back pain. It kind of goes down to the knee.
Yes, sir.
So go ahead and take bend forward at the hip for me. So we're just going to check his range of motion. When we're checking your range of motion, you're always going to look down the back, and you can see it actually looks pretty good. If he has scoliosis, that actually hump over that side of it all. Now I've never actually seen him before. So all the observations are being totally first time. And you can feel, you can get a little view on this one here. I don't know if you guys can see this right here, but you can actually see this muscle. It's actually a little bit higher compared to this side over here. It's higher right here and higher right here. So he's got this little Z pattern, and it's definitely diagonal. That's a really good indication that he's probably got some weak gluteal muscles and extensor muscles that is probably activating or overactivating this side over here. Is that tender at all?
Yes.
Okay. How about over here?
No.
Okay. Anything right through here?
A little bit.
Is it more tender over here?
Very.
Okay, so it's very tender right here. So, and that's just from him bending forward. So go ahead and sit up all the way and bend backwards. Is there any pain there at all?
No.
Okay, good. So nothing down the leg?
No.
Great. Now bend to that way. Good. He looks great there. And bend this way. Looks great there. Now the problem you're seeing is he's actually bending his knee, and that can actually be due to guarding, but we'll check it again. So try and bend that way again without bending the knee. Is it different? So thing to look out at when you guys are going side to side, make sure you're actually not bending your knee, which is compensating. So when you stood up straight again and you bent over that way without bending your knee, it caused more pain.
Yes, I typed that right away.
Okay. Try the other way for me as well. How about that one?
It's not that bad.
Not that bad. Okay, so when we just pushed on the right side, it was painful, but when you actually bent that way, it hurt on the left side or the right side?
The right side.
On the right side, okay. So go ahead and stand up on the tippy toes. So we're just checking some nerves out and down and up on the heels. Good. We're going to check his brain out, basically his body positional awareness. So the brain is a compensation mechanism. So you can see right now, just by looking at him, how far forward his right wrist is compared to his left. And also that there's not a lot of space between this elbow and this chest here, but there's a lot of space between this elbow and this chest here. And that's a good indication that he's twisted in the upper back and kind of shoved over to the side. So go ahead and put your ankles and toes totally together. Good.
Should I take this?
Nope, you're totally fine right there.
Okay.
Go ahead and stand nice and relax. Good, now relax your shoulders. Good. Now, I'm going to put my hand out here in case you fall, but go ahead and close your eyes. So what we're looking at is sway. You can see he's kind of slowly going over the right side, right? So go ahead and turn your head to the left. We're going to check left cerebellum. Keep your eyes closed. You can see he's wobbly. Now he's kind of slowly going over here. He's kind of bouncing.
Is it bad that I'm trying to control it?
No, I want you to control it, otherwise you're going to fall. So turn your head to the right. And you can see how it's just, he initially started kind of going backwards to the left, and now it's kind of going forward to the right. So go straight again. And then he's back straight to the right. So he's got some compensation mechanisms that are going on. So we're going to correct that. In order to actually have a person feel good for a long period of time, you really need to correct balance or positional awareness. So put your ankles and toes together again for me. Now I'm going to stimulate the right side of his brain by adjusting his left elbow and his left wrist. Remember, this is the okay one supposedly, right?
Yes.
And then we're going to recheck your balance after that as well. So I don't care if it pops a lot. There, ooh, but it did. You feel that way? Now I'm going to go ahead and get the wrist as well. Keep your head straight. Close your eyes. There we go. Get his fingers. Good. Go ahead and open them. Okay, now let's go ahead and check your sway again, see if we corrected it, okay?
Okay.
Go ahead and close your eyes. Good. Now, does it actually feel better to you now?
Before I felt myself take off to the right.
Yep. Go ahead and close your eyes again. So right initially, you're not actually seeing that weird sway pattern that's going on. So that's a good thing. That means that we've actually corrected that pathway. Now go ahead and open your eyes and take a relaxed stance and bend forward again like you did before and see if there's any difference there. How's that feel when you do that?
Not as bad as when I bent over the first time.
Okay. And you can see that this side is actually less. That muscle has actually relaxed. So I'm going to push a little bit harder. How's it feel now?
Just tight.
Okay. Is it as painful as it was before?
No.
Good. So you can already tell that he's already got he's got an improvement in muscle tone. It's definitely more even on the side, and he doesn't have as much pain. And we haven't even touched his back yet. Go ahead and sit up straight for me. Good. Now let's go ahead and just check your positional awareness up in here. And already you can see some gaps through here and some gaps through here, and his wrists are actually more even, so that rotation's already significantly reduced. So, and we just adjusted his elbow and his wrist in order to correct a brain imbalance, is what I ended up calling it. So, how's it feel so far?
My back's kind of hurting now.
Is it on the other side?
It's right here.
It's on the other side. Okay, that's how it should be. Okay, that's good. Now, go ahead and bend to the right again. Make sure you don't bend your knees. And tell me how it feels. Good.
Good.
How about the other way? Any change there?
A little bit.
So before you had pain going to the right, and then what? Okay, good. So it's definitely changed, and the reason is because you're actually using that side again. So that's a good thing. So the interesting part is a lot of this issue is due to compensations. So from a brain-based issue. So I'm assuming that you're doing a lot of repetitive work down and to the left. That's what I'm assuming.
Picking up boxes?
Yeah, like that right there.
Boxes.
So it's usually down to the left. So it's almost always the opposite of where the muscle spasms are.
Mm-hmm.
So in other words, his brain literally thought his head was here, and in order to keep him upright, the body actually had to contract the muscles on the opposite side, which is keeping him nice and tall, but it's also causing him pain. So go ahead and have a seat for me. Now let's just go ahead and check a couple other things. Now stick your foot out like that. And he's not leaning back, so that's a good thing. Let's check the other one. He's not leaning back there at all, so that's good. Let's go ahead and just check some hip flexors. Push up on my hand as hard as you can. Nice and strong. Another one here. Nice and strong. Push up on my hand forward here.
Oh.
Towards me. Nice and strong. Do it again. So you notice I'm actually holding that motion just a teeny bit longer. This tests that often doctors do with they push up on the hand and like, okay, we're good. You actually have to hold it in order to determine where that nerve and that muscle is actually working for you. Mm-hmm. Go ahead and lay in the back. So face up.
Okay.
There you go. So when they're laying on the back, we're going to make a couple of different observations. One, I'm going to check his chest height on one side or the other. Looks pretty dang good. We're going to check his abdomen. Looks good. We're going to check his hips and to see if one's actually poking out more than the other one, and it's not. So we know there's not a lot of other issues that are going on there. So we're going to go ahead and just check his some more disc issues, okay? So lift this up straight as you can, as far as you can. And he goes way more than he should have to, so that's good. Any pain in the lower back?
No.
Good. How about the other one? Anything there besides the tight hamstrings?
No.
Okay. How about both at the same time? This one actually checks the ligaments and the muscles down there. Any pain down there as you went down?
No.
Okay. No? Okay, good. So that's a good thing. Go ahead and flip over on the belly for me. So we've got him on his lower back, or on his belly anyway, not his lower back. And we're just going to basically just check, again, his entire spine. We're going to check the muscles out along the way, see if there's any compensations. Remember, we already corrected that brain issue, that positional awareness problem. And you can see the muscles are actually nice and even. You can move them pretty well. How's that feel?
That right side hurts.
It's over here?
Yeah. Ow.
Right here?
Yes.
How about up in here? So it's a little ticklish. Does it hurt all the way up there?
No. Ow.
We can keep on going. This is good. So this is more fun than anything. So although the muscle's gone down, or the tension's gone down, you're still painful there?
Yes, just
Okay.
a little bit.
So that's a good indication that we actually have a neurological issue where the muscle and the nerve meet. So we're going to look at that spine right in there. And I'm just basically taking my thumb and moving along that vertebra there, each different directions.
Ow.
Right there's a bad one.
Yes.
Relax it. Thank you. And right there's a bad one. And right there's a bad one. So what I'm feeling is this the spine is actually moved backwards to the left side. You can feel it over right here, and right here, and right here. And I'll compare this side over here, and he's got one right there. You feel that one right there?
Yes.
Okay. He's like, yes, stop poking it. But so although it looks cruel that I'm poking it that much, I actually need to do that to make a complete assessment of what the heck is going on with him. We don't want to just be adjusting things when we don't have a complete picture. So I'm going to check out his pelvis. I'm going to do this test here just to check the SI joint. Any pain here?
Yeah.
I'm going to check this side over here. Any pain here?
Yes.
Okay. So I'm going to try and put the same amount of weight over here. How about this one over here?
No.
So just a light amount of weight over here, and he's already guarding me for when I was just getting in position. So that's a good indication that he's got a ligament issue also. So I'm going to check your sacroiliac ligaments out. Any tenderness through here at all?
Yeah, just a little.
A little bit on that left side?
Yeah.
How about over here?
Yeah.
Okay. How about the right side?
Yes, more so.
More so.
Ow.
So his SI ligaments are really tender. You said you do a lot of lifting and bending and twisting and stuff?
Yes, sir.
Do you have pain when you're going from a sitting to a standing position?
Not normally, but I have before.
You have before. What about getting out of your car?
Not normally, but yes, I have.
But it has
before.
been before.
Yes,
Okay.
sir.
So he's got a little inflammation along the SI ligaments, and oftentimes that's due to repetitive movement. So I'm going to check this one out here. Any pain here?
No.
And how about here?
Yes.
Okay. So he's got some local inflammation and local pain on that side. So we've pretty much determined that he's suffering from a local inflammation with muscle spasms and rotated vertebra. It's a really good indication that chiropractic will help you. So we're going to go ahead and get that adjusted. Is that okay?
Yes.
That's powerlifting, I think.
Oh, he does powerlifting.
Powerlifting.
Haha. Okay. How often are you doing that?
Every day.
Okay. What type of powerlifting are you doing?
Squats, bench,
Okay.
deadlifts.
Okay. So now we've got him on his side. His mom says that he does powerlifting every day, and he's finally fessed up that he does it every day. I asked him if he does it a lot. Apparently, every day does not mean a lot for him. That's what happens when he's 19, right? So, when he's on his side, we're just going to check that again. And it's a lot easier to feel the vertebra right here. So that's the one we're going to go for. Is that pretty much the painful one?
Oh my lord, that hurts.
Okay. If you're doing a lot of squats, and are you doing deadlifts?
Yes, sir.
Okay. So I'm assuming, based off of what I'm finding here, is that you're actually squeezing that right glute a little bit more than the left-hand side. And you're probably lifting a little bit more on the right side than the left side. Is that right? That is right. It's like I've been doing this before, right? So in other words, he's helping his brain out along where it's weak. And that weakness is causing this chronic continued pain in the lower back, and it's setting you up for disc herniation in the future. So to get that high vertebra, we're actually going to move his leg forward. And we're going to rotate him here. There you go. Don't worry, you're not going to fall. I've never lost anybody. So the reason why his hip is forward is because the further we bring him up, the higher the vertebrae actually move. So we're going to bring it way up here to isolate that vertebra. This is where chiropractic is a little bit more specific for its treatment modalities. So you feel it right there?
Yes.
And you can see how far I had to get his leg up there. So I had to get his leg way up here in order to actually isolate that vertebra. So I know it feels like we're just rolling you. So, okay, here we go. Take a breath. Let it out. Go ahead and get close in on this one. Ready?
Yep.
There it is. That moved a lot. Do you feel that move? Yeah. Okay. You okay?
I felt like my whole body popped.
Yeah. That moved good. So we're going to check it again. Doing the same thing. And you don't feel that vertebra sticking out to the side. How's it? I'm pushing pretty hard. How's it feel?
It feels way better.
Yeah, all right.
A second ago, I was going to tell you it felt like you punched me right there.
I kind of did. So we're going to go ahead and get his SI joints as well. There it is. That was good. Go ahead and lay in the belly for me. So go ahead and, you always want to check afterwards and see how it looks. How's that feel now?
Way better.
Yeah. So the really neat part about the adjustments is that the muscles immediately relax. And you can see them. You can actually move it now. I'm pushing pretty hard in there. Any pain there?
No.
I'm going to see if... Because I know some of you guys are going to say, well, you're not poking the same. How about now?
No, just...
Okay.
Poking me.
So no increase in pain though, right?
No.
Now, I'm doing the exact same thing. I'm just checking the vertebrae out. How's it feel now?
Not the same.
Not the same. Does it feel better now?
The right side feels better. The left side still feels the same.
Okay, so let's go ahead and get that that left side now. So, go ahead and lay on the right side. Okay. So, we're gonna do the same type of thing. I'm gonna scooch him forward a little bit. There we go. You're lucky I'm a big guy. So we're gonna do the same type of thing. So now we've got him on his right side. We're gonna do the exact same assessment. Again, I'm gonna put my finger along the spine. That feels like it's a bad one right there. That one's not so bad, but that's pretty gnarly right there. Is that one there too?
Yes.
And how about this one down here?
Yes.
So he's got 3 major areas. Right here is really bad though. So again, leg position. Got to get him way up in here to actually open that up. I'm going to bring him down, otherwise I'm going to jam his shoulder. Does that feel better now? Yes. Okay. Good. Put it way up top. Take a breath. Let it out. There it goes. That was 3 of them right there, wasn't it? Good. Now let's go ahead and reassess. How's it feel now?
It still kind of hurts a little.
Right here?
Yes.
Okay. So let's get the actual one that hurts right there. There's that one. Feeling beat up yet?
Yes.
How's this one now?
That one feels good. That one, what you
This
just
one?
touched right, yeah, that hurts.
How about right here now?
That hurts too.
Okay. So go ahead and lay in the back for me. Go to the back. So oftentimes these residual pains are actually due to muscle spasms. So we're going to go ahead and stretch him out. Since he does a lot of weightlifting, you can just feel how tight it is already. It's kind of going chunk, 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 chunk. It's that ratcheting. You feel that?
Yeah.
Good. Breathe. Good. Breathe in. Good. And how about here? You feel that one?
Yeah.
Okay. Good. All right, relax. Good. Go ahead and give yourself a big hug. Now, this is a coffin hug. I hate that hug. We know death here, man. So we're going to love yourself. So, we're going to do this lower one here. Just like this. Just like that. Did you feel that one? Good. Go ahead and lay towards me. Good. Now let's check it again. How's that feel now?
Better.
Better? How's this one feel now?
Better.
Okay. So it was a combination of muscles because these muscles are really tight, and then he had this vertebrae was low enough on him that I can actually get it doing what's called an anterior. So go ahead and stand up for me now. Okay. So right off the bat, we're going to check and see, again, his posture. You can see how his hands are actually off of his hip now. You can see that you have gaps in between, which is actually a good thing. It means there's not a lot of rotation in there. Go ahead and bend forward for me.
I feel way better.
You feel better? Yes. Good. How's that feel now?
Way better.
Way better. Cool. Now come on back up. There's a reason why chiropractors are used by sports people a lot. So, 'cause you just feel good. So, all right. Go ahead and put your ankles and toes together. And nice and tall. Relax your shoulders. Good. How's that feel now?
Good.
Good. Turn your head to left. Good. Turn your head right. Good. How's it feel now? Does it feel better now?
Yes.
All right, cool. All right, guys. So that was a full examination of the lower back and right wrist, and we did a treatment of the right wrist. And we're gonna have to follow up with that with some Prolotherapy to stabilize it. Specifically, if you're a bodybuilder, you're gonna want to do that anyway, man. Do you feel good or not?
You're very.
All right, cool. All right, guys. There you go.